So what are fillers? With the term fillers, we describe any substance that we can use to fill our face or our body and to erase folds and wrinkles that of course we don't like. There are three main categories: the permanent ones that I personally avoid, like the silicone, semi-permanent, and there are many under this category, and the temporary ones. Main one is the hyaluronic acid that are more frequently used lately. What are the differences of these categories? I would say that the permanent fillers, like the silicone, last in theory forever, but of course we cannot remove them easily, they need a surgery, and of course if we have complications, it's a real problem to manage them. The semi-permanent, they last a few years, they work by inducing collagen production, and of course again, if we have any complications and side effects, they need special management, they cannot be easily removed. But we have the temporary ones. The main one, as we said, is the hyaluronic acid. This is a substance that we have in our skin naturally, but of course as we age we don't produce that much, and we go and we add it where we need it to restore volume and to erase wrinkles. It has the ability to gather molecules of water on it, so it improves our skin also, and it can be removed whenever we want it by an antidote. And of course it depends how long it lasts. It lasts from 6 months to maybe even 2 years sometimes. It depends on the filler that we will use, and this is something you must discuss with your doctor. How are they done? The fillers can be injected in your skin through a very thin needle or a cannula, and that depends on what type of filler and what is the area that we treat. You can discuss with your doctor, of course, in which cases we use each of these methods, and of course what are the advantages and disadvantages of each method. Which areas can we treat with fillers? We can treat actually the whole face. We can treat the nasolabial folds, the marionette lines, your lips, the nose, when we reshape the nose, the frown wrinkles, the forehead wrinkles, the tear trough, the cheekbones, the temporal area, the jawline, the chin, anywhere you can imagine on the face. And also we can fill gaps or restore volume on our body, like the upper area of the hands, the thighs, wherever we need to restore volume or to erase wrinkles. And of course each of these areas needs a different filler and a different amount, and this is something you must discuss with your doctor. Do fillers have complications, side effects? Of course they can have some serious side effects, especially the permanent ones that I avoid, like the silicone. As we said, it cannot be easily removed if it has any complications. The semi-permanent, they can have some complications that need special management from the doctor, that needs of course to know how to manage them. And the temporary ones, usually they have more local minor side effects, like a bit of bruising or a bit of redness, minor swelling that go away after a few days, but they can also have more serious side effects, like block of an artery or to affect your vision, and these side effects must be managed by an experienced, trained doctor. That's why you must always go to a proper professional to have your fillers done. Do fillers have antidotes? Can they be removed? I would say that only the temporary ones, which is the hyaluronic acid actually, can be completely removed with an antidote that is called hyaluronidase. You can use it either immediately or anytime in the future to actually restore the area to how it was before and completely remove the filler. The other fillers, the semi-permanent and the permanent, of course, cannot be removed. In general, do I like the fillers? Do I suggest them as a treatment? The answer is definitely yes. I have fillers on my face. You can see it in other videos at my channel, how I do fillers on me. They can do a fantastic work, a fantastic result on our face or on our body if they are done properly and at the right amount. That's why it's very important to go to a proper doctor that is trained on fillers and can explain to you what he can achieve and not to what amount and which filler he can use for each area that you want to, of course, improve. So don't be afraid to actually go and have your fillers done. Don't forget that the temporary ones can be dissolved if you don't like them, and of course you will have fantastic result if you have realistic expectations and you discuss with your doctor what you want to achieve.